So hello and welcome everyone. Today we are going to discuss something that is known as osteosarcoma. This osteosarcoma is a topic from the musculoskeletal system in pathology. So what exactly is osteosarcoma? First we'll go on with the name itself. So osteo refers to something that is related to bone. So anything that is related to bone is given the name as osteo. Whereas sarcoma refers to a form of tumor. And what type of tumor? It is a form of malignant tumor. So you might have learned it in the nomenclature of neoplasia that any tumor that ends with sarcoma is referred to as a malignant tumor. Whereas there may be some exceptions such as myeloma. Myeloma, it does not end with sarcoma. However, it is a malignant tumor. It is the malignant tumor of plasma cells, which we'll be discussing shortly. Now, before we talk any further about osteosarcoma, in order to learn the clinical features, we'll try to take a case from history about a classical case of osteosarcoma. Okay. Now we are going to take a case presentation. This case presentation is about a young girl who was having a hard mass on her left thigh. So as you can see in this drawing, this patient is having some sort of hard mass on her thigh region. Okay. Now she comes to the hospital. Okay. She comes to the hospital and we take the history. What we have found is that her age is 18 years. The name is Miss Fatima. Her age is 18 years. This is suggestive of the fact that she is an adolescent. 18 years suggests that she is an adolescent, and so other things are not so important for our diagnosis. Now we ask the patient what problems is she facing. So she says that she is having pain just above the left knee joint for about 3 months. So she's having some sort of pain, and she is even having swelling, right? So she is having some sort of swelling, and then there is an inability to walk. So she has an inability to walk, and this is especially we can write it as there is a decreased joint mobility. So there is a decrease in joint mobility, and the decrease in joint mobility is the reason why she is unable to walk. Now we ask her about her further illness. She says that she was very much well 3 months back. However, she just developed mild aching pain just above the left knee joint, which was not associated with fever. And something that is important is that pain is non-radiating, aggravated during walking, and it is getting worse at night. Okay, so this pain is getting worse at night. So we'll write it here. This pain that she is having, it getting worse at night. So the pain gets worse at night and is particularly relieved by taking NSAIDs. So you might be knowing what is NSAIDs from pharmacology, the non-steroidal anti-inflammatory drugs. She even complains that she noticed swelling above her left knee joint nearly 2 months back, okay, which was associated with pain, okay, but initially it was small in size, and then slowly it started increasing in size. However, she does not remembers any thing or any trauma that she has come across. Okay, so there is no history of trauma. What is trauma? Trauma is any form of injury. Okay, it is any form of accident that can cause significant damage to the body, or it can affect the parts of the body. Okay, so that is trauma. Trauma is referring to any form of accident or any form of incidents. So in addition to swelling, there is a sudden deformity of the left knee, and she cannot walk without support. Okay, so she cannot walk without support. Now on local examination, what do we find? On local examination, we find out that when you are looking at the knee, it is looking something like this, as you can see in the drawing. So the knee, there is a swelling present. Okay, so there is a swelling present, and you can see here the veins are being seen. So here the veins are visible, and the skin is shiny with presence of engorged veins. So engorged veins are being seen in this knee region. Okay, so veins are being seen. These veins are very much prominent. Now, out of all these, from all these things, what is the provisional diagnosis? You are a doctor. What do you diagnose? Okay, from all these cases, from all these things. So let us write a summary of whatever we have learned. You need not know everything in detail. We'll just try to make up something as a as a summary. So if you look at the summary of what we have encountered, you'll see that the age of the patient is 18 years. This means that she is an adolescent. The complaints are pain in the knee joint, which is getting worse at night. There is swelling. There is no history of trauma, and there is a decreased mobility of joint. The clinical features is that the skin is shiny with engorged veins, right? Okay. Now, Now after this, what will be the probable diagnosis of the patient? Now the probable diagnosis of the patient can be something as, I'll tell you something as. So you have learned everything. Okay. From this, there are possible two diagnoses. One is the case of osteosarcoma, and the other is the classical case of Ewing sarcoma. It has to be noted that both of these tumors possess almost similar clinical features. Both of them are associated with pain. Both of them are associated with swelling. Okay. Both of them are associated with pain, and both of them are associated with swelling. But one has to note that there is some difference between the two, and the thing is the location of the two. Osteosarcoma is a metaphyseal tumor. That means it is going to affect the metaphysis part of the bone, whereas Ewing sarcoma is an epiphyseal tumor. That is, it is going to affect the epiphysis part of the bone. Okay. Now, how are we going to make our differential diagnosis? How are we going to be sure that this is the case of osteosarcoma and it is not the case of Ewing sarcoma? This is by some of the radiological investigation. We are going to take the help of radiology. We are going to do some sort of X-ray to the affected part, and then we can find out whether it is the case of osteosarcoma or not. What are the radiological findings is what we are. It is a matter of discussion in the later part of our lecture. For now, we'll discuss some of the introductory points about osteosarcoma, and then when we talk about diagnosis, we'll be talking about the radiological investigations. Okay. Now we'll be talking about the introduction about osteosarcoma. Now, osteosarcoma is the most common primary malignancy of bone. Okay, so the most common primary malignancy of bone is osteosarcoma. Sometimes you'll see that the most common primary malignancy. If the question is asking you what is the most common primary malignancy or the most common primary tumor, at that time you are going to give the answer as myeloma. As I have talked to you earlier, myeloma is the malignant tumor of plasma cells. Often we find that there is multiple bone lesions at the time of diagnosis of myeloma. That is why myeloma is often referred to as multiple myeloma. This osteosarcoma is a bone forming malignant mesenchymal tumor. That is, there is the formation of osteoid. Okay, so in osteosarcoma there is the formation of osteoid, or you can say there is calcium deposition in bone, and this formation of osteoid is a very important thing, and this is referred to as the hallmark of osteosarcoma. So it has to be noted by everyone that osteosarcoma is a bone forming tumor. There is the formation of osteoid, and hence it is regarded as the hallmark of osteosarcoma. Now, the bimodal age distribution. This cancer is having bimodal age distribution. What exactly is bimodal age distribution? If you look at the patients who are suffering from osteosarcoma, you will find that there are two distinct age groups that are generally suffering from the disease. Okay, so generally, when we are talking about like some sort of cardiovascular diseases, you will find these type of diseases generally in the older patients. You do not find young adults, suffering from cardiovascular diseases. But this disease has a bimodal age distribution. That means there are distinct age groups that are suffering from this disease. Okay, so 75% of the patients are below the age of 20 years. That means they are adolescent. So nearly three-fourth or nearly 75% of the patients who suffer from osteosarcoma are young people whose age is below 20 years, and such type of osteosarcoma is referred to as primary osteosarcoma. Whereas 25% of the cases is seen in elderly population, and such type of tumor is referred to as secondary osteosarcoma. This 75% of the adults that suffer from osteosarcoma generally have the history of some of the generally they possess history such as they have been suffering from some type of bone lesions, and these bone lesions can be what we know as the Paget's disease of bone, the some sort of bone infarct, and some sort of radiation exposure. This radiation exposure, there was a case of the osteosarcoma that was seen in a watch factory. Okay, in the watch factory that generally manufacture watch dials, that was due to the exposure to a radioactive substance that is known as radium. So exposure of radium in watch factories. Okay, so what we have found out, like to give you the summary about what we discussed just now. Okay, so what we discussed just now is something that what we discussed right now was something that this osteosarcoma has a bimodal age distribution. Bimodal age distribution means bi means two. So there is two distinct age groups who are suffering from this disease. 75% of the patients who suffer from osteosarcoma are young people whose age is below 20 years. Okay, and then 25% of the patients who suffer from these diseases are elderly patients that generally have the history of some sort of bone diseases like Paget's disease of bone. Okay, and then there is some sort of bone infarct, or it may be radiation exposure. So these are referred to as the risk factors of osteosarcoma. Okay, are there any other things that can cause osteosarcoma? So there is a genetic basis of osteosarcoma. Okay, now if you are talking about the genetic basis of osteosarcoma, we'll find that there is a gene mutation, RB gene mutation and P53 gene mutation, or we can tell that the decrease in activity, okay, the decrease in activity of RB gene or a decrease in activity of P53 gene can lead to osteosarcoma. These two genes are the protector of our system. Okay, they are a form of tumor suppressor genes. Okay, that prevent, that has a check on the cell cycle. Now its decreased activity of RB gene, decreased activity of P53 gene, or a mutation in these genes are can lead to osteosarcoma. If there is a decrease in activity of these genes, the overactivity or an increase in activity of some of the genes such as CDK4, cyclin dependent kinase, and MDM2, these two genes, the overactivity of CDK4 and MDM2 genes, these can lead to the osteosarcoma. These two genes are a regulator of cell cycle. They increase cell division. They increase the proliferation of cells. So the overactivity of cyclin dependent kinase 4 and MDM2 genes, these are suggestive of the fact that the patient is suffering from osteosarcoma. So these are some of the risk factors of osteosarcoma. All right. Now, if you look at some of the theoretical points, the male-female ratio is 1.6:1. That means it is more dominant in males than in females. And if you talk about the site of occurrence, it is the metaphysis of long bone. Okay, so you might be knowing what is metaphysis. If you talk about a bone, then this bone is going to have two distinct parts. One is known as the epiphysis and the other is known as the diaphysis. Diaphysis is referred to as the shaft of the bone. Epiphysis is the end of the bone. So there is a portion, okay, between the epiphysis and the diaphysis in growing bones. This part is known as metaphysis. Generally, metaphysis is the growing end of the bone. Okay, it is the growing part of the bone. Okay, so the site of occurrence of this is known as the metaphysis of long bone. And you can see that the most common bone is the knee. So knee is the most common joint, okay, which is affected. So as you can see in this drawing, 50% of the cases of osteosarcoma, it is occurring in the knee. So if you talk about the site of occurrence of osteosarcoma, I'll cut this and I'll write it is as the lower end of femur. Okay, the lower end, this is the femur bone, the lower end of femur, upper end of tibia. These are the most common sites for osteosarcoma, and even upper end of humerus. Okay, upper end of humerus. Okay, so the site of the occurrence of osteosarcoma is lower end of femur, upper end of tibia, and the upper end of humerus, where the most common is this one. So this is most common. Just remember femur, tibia, and humerus. Okay, now what is the clinical course? Okay, what is the clinical course? The clinical course is that it is typically present as a painful enlarging mass. So we have already discussed it in that case as well, that it is a very painful This pain is getting worse at night, worse at night. There is night pain. Okay, there is a mass that is present around the bone, and there is sudden bone fracture. Okay, and this is sometimes the first symptom of osteosarcoma. In this, I like to add a point: sudden bone fracture, it is something that is known as pathological fracture. Now, what is pathological fracture? Now, I'll give you an example. Like, pathological fracture is that, you generally, when you are playing football, you might fall down, and you might develop a fracture. That is something that is known as a physiological fracture. But pathological fracture is when, like, for example, this is you are having some sort of pain. Okay, you are having some sort of pain in your hands, and you go to the hospital. When the doctor does an x-ray, the doctor tells you that you are having a fracture, and you have no idea how the fracture is caused, because you do not remember any significant history of trauma. Okay, you do not remember any such factors that can lead to a fracture. This is something that is known as pathological fracture. Pathological fracture is something like, there is a fracture, there is a damage to the bone due to some sort of minor trauma, which in a normal individual will not cause any harm. That is known as pathological fracture. So even a minor injury, a minor trauma is causing the fracture. Okay, is causing the fracture, which in a normal individual will not cause any sort of damage. That is known as pathological fracture. The bone is getting weak within itself. Okay, there is no any external factors that is causing the fracture. That is referred to as pathological fracture, and hence there is a sudden bone fracture, and this is sometimes the first symptom of osteosarcoma. Okay, so this is very important, and you can how you can relate this is from that case file as well. So I'll take you there once. Here something was written, like the patient says that she has no any history of trauma. Why this is very important, and I put it in star, is this is one of the features of osteosarcoma. There is a pathological fracture, and hence the person does not remembers any significant history of trauma. Okay. Okay, now we'll be talking about the metastasis. So as you know that it is a malignant form of tumor, so it is going to get what it is going to get. It is going to get it is going to metastasize. So where does it metastasize? The most common location of metastasis is the brain. Okay, osteosarcoma generally most common site is, sorry, it's not the brain, it is the lungs. Okay, it is the lungs, and then it can spread to other bones, and it can spread to the brain. Now, talking about the diagnosis of osteosarcoma, the one thing that we can do is the X-ray. So, if you do the X-ray like we discussed in the beginning of the lecture, when we are making a diagnosis, we are taking the help of radiology. Okay, we are doing the X-ray. Now, when we are doing an X-ray, what we have found is that for example, this is the bone. Okay, this is the main outline of the bone. Now, the peritoneum of the bone is getting lifted. Okay, so this is the peritoneum of the bone. The peritoneum of the bone is getting lifted, and then if you look at this area, a triangle is being formed, and this triangle is what we known as the Codman's triangle. So one of the important features of osteosarcoma is that there is the lifting of peritoneum. This lifting of peritoneum is going to form a triangle, and this triangle is what we call as the Codman's triangle. Okay. Similarly, there is something that is known as sunburst appearance. Now, sunburst appearance drawing, I don't think it is here. So let me do something. So you can see this. This is this gross. I'll tell you later. Okay. So we'll talk here. Okay. So you can see that this is the bone. This is the outline of the bone, and the peritoneum is being lifted, due to which a triangle is being formed. This triangle is known as the Codman's triangle. Okay, this Codman's triangle is formed due to the lifting of peritoneum. Okay, similarly, if you look at this drawing upper one carefully, you will find that some type of ray like structure is coming out of the bone, right? For example, if you consider a sun here, so some ray like appearance is coming out of the bone. Okay, so some ray type appearances are coming out of the bone, and this ray type appearance that is coming out of the bone is what we call as the sun ray or the sunburst appearance. Okay, so this is what we call as the sun ray or the sunburst appearance. So this is what we call as the sun ray or the sunburst appearance. Okay, now so two major radiological course about osteosarcoma. Okay, about osteosarcoma, two major radiological investigations, two major radiological findings. One is known as the Codman's triangle. This Codman's triangle is due to the lifting of peritoneum. And then the second one is the what we call as the sun ray or the sunburst appearance. This sunburst appearance is actually, as it is a bone forming tumor, the calcium deposition on the bone, due to this calcium deposition on the bone, the sunburst appearance is being seen, right? Now if you talk about the gross morphology of the bone, as you can see here, you'll see some hemorrhagic spots. Okay, so there are some red to gray hemorrhagic spots. So there is actually red to gray hemorrhagic spots. This is generally due to hemorrhage and necrosis. Okay, hemorrhage and necrosis. And the tumors are quite gritty. Okay, it is very much gritty means it is somewhat, it is not soft to touch. So as it is a bone forming tumor, you can understand why it is gritty. So there is some sort of hemorrhage and cystic degeneration as well. Now if you look at the morphology, you will see that, there are some sort of like these type of cells. These are actually the osteoids. Okay, so lace like pattern is seen. You can see that such type of cells are seen, such type of pattern is seen. This is what we call as the lace like pattern. Morphology of osteosarcoma reveals the presence of osteoid are nothing but, these are glassy lacy like substances. Now, we have already talked about metastasis. The commonest site of metastasis is the lungs, that we also call as pulmonary metastasis. Similarly, it can be bone to bone, and it can even be what? It can even be one can be lungs, one can be bone to bone, and the other can be brain. Now, what is the treatment? What is the treatment of osteosarcoma? It has to be noted by everyone that osteosarcoma is a radiolucent. Okay, it is a radio resistant tumor. It is a radio resistant tumor. This means that it cannot be treated by radiotherapy. So radiotherapy, we cannot treat this type of cancer, this type of tumor by radiotherapy. So it has to be noted that osteosarcoma is a radio resistant tumor, and hence it cannot be treated by radiotherapy. One thing that we can do is surgery. In surgery, we just remove the tumor. Okay, remove the tumor. So amputation is done. And if you are talking about the drug, then the drug that we can use is something that is known as methotrexate. So these are all the treatment. So the drug that we can use is something that is known as methotrexate. If you have an idea of methotrexate, it is, you might have learned it in pharmacology. It is the drug of choice for rheumatoid arthritis. So this drug can be used in the treatment of osteosarcoma. Now after this, we'll just be talking about, let us look at Robbins, if there is anything extra given there. So we'll go on very quickly. Okay, so osteosarcoma, as you can see, it is a malignant form of tumor, as we have discussed, as it is ending with sarcoma, in which the cancerous cell produce osteoid matrix or mineralized bone. So there is the formation of osteoid matrix or mineralized bone, and it is the most common primary malignant tumor of the bone, right? Now, if you look here, there is the bimodal age distribution. 75% occur in patients younger than 20 years, and the second smaller peak occurs in older age adults. And these older adults generally have some sort of diseases, some sort of history of diseases like Paget's disease, bone infarct, or some sort of radiation. We have found that men are more commonly affected than female. Okay, and it is a form of metaphyseal tumor. Okay, so it is a form of metaphyseal tumor, and 50% of these occur in the knee region. Okay, knee region. Now osteosarcoma, the presentation is painful and enlarging masses. Sometimes there is a sudden fracture of bone, which is the first symptom that we talked as pathological fracture. Okay, now under radiological investigation, we have found that there is the lifting of peritoneum, due to which there is the formation of Codman's triangle. Okay, So there is the lifting of peritoneum, and this triangular area is what we call as the Codman's triangle. Now we'll go on to this page. Now if you look at the genetic basis of osteosarcoma, you will find out that the RB gene, it is there is a decrease in activity of RB gene and P55 gene, right? You might be knowing these all genes, you might have studied in neoplasia, and there is an increase in CDK4 and MDM2. Okay, so RB gene, as you can see, as you know, retinoblastoma gene, it is a negative regulator of the cell cycle. So it is a negative regulator of cell cycle. It is a tumor suppressor gene. And TP53, which is also known as guardian, so this is also it also checks DNA repairs and everything. So this the activity of these genes are decreasing, okay, and the tumor genes are increasing. So MDM2 and CDK4 are cell cycle regulators, so due to which there is an increased proliferation at these sites. Now if you look at the morphology, osteosarcomas are bulky tumors that are generally gritty, gray white, and often contains area of hemorrhage and cystic degeneration, and the formation of bone by the tumor cell is the hallmark. Okay, and this formation of bone is what we call as osteoid. So this I have already explained to you. This was the drawing that I had kept there. Clinical course. So the clinical course is that it is treated by surgery. Okay, it is treated by surgery, and this tumor, as you can see, it is a malignant tumor, so it spread hematogenously to the lungs. So most common site of metastasis of osteosarcoma is pulmonary metastasis, that is to the lungs. Okay, here it is written pulmonary metastasis. So fine lace-like pattern of neoplastic bone cells are seen in osteosarcoma. Okay, so these are lace-like pattern of neoplasia. Now the last slide. So something that is very not so important is written here. So this is all about osteosarcoma. We even read it from Robbins, and it's a very easy topic. Okay, so I hope you understood. Thank you very much. Thank you for listening.